Hello, my name is Roxy and I am one of the nurses on the Stroke Rehabilitation Unit. We welcome you to rehab and we thank you for the opportunity to assist you through the recovery process. I would like to provide you with an overview of stroke rehabilitation, what we do as a team in helping your loved one through the recovery process and how this is accomplished. I will also discuss the different roles of the members of the healthcare team and what to expect while your loved one is here. Our rehabilitation cares for patients who have had a stroke and are medically stable but still require rehabilitation. We also care for patients who have neurological conditions, orthopedic injuries, or have suffered from a traumatic event. One of the main goals of rehabilitation is to help patients reach their highest level of functioning. During the hospital stay, members of the healthcare team will provide education to you and your loved one about strokes, medications, and the care that is being provided, and information about the different therapies. We understand that strokes not only affect the patient, but the entire family. We will offer emotional support as you and your family go through the recovery process. Our physicians are able to manage medical conditions that your loved one may have had prior to the stroke and complications that may be the result of the stroke. Finally, our case manager and social worker will work with you in the discharge planning process. We use a coordinated team approach to manage all aspects of care. Similar to the acute units, rehabilitation doctors and nurses will provide care to your loved one. The main difference between acute care and rehabilitation is that patients are now encouraged to do as much as possible for themselves, keeping safety in mind. Rehabilitation consists of a minimum of 3 hours of therapy each day, Monday through Friday. These therapies include physical therapy, occupational therapy, and speech therapy. We also have a music and recreation therapist that can work with you and your loved ones. A rehabilitation psychologist, a social worker, and a case manager also play an active role in the rehabilitation program. Nutritional and respiratory therapist care is provided as needed. Of course, your previous physicians, such as your trauma surgeon, neurologist, or neurosurgeon, are still available and will continue to follow up as needed. For patients who need a specialist, a physician at MetroHealth can be consulted. Here is a list of members of the stroke rehabilitation team. Note, there are many members of the stroke rehabilitation team, but we consider the patient and the family as the most important members of the team. We also encourage and appreciate your input into the plan of care. Communication between team members is the key to successful coordination of care. As a team, we frequently meet to discuss your loved one's plans of care. On admission, all members of the healthcare team will do an assessment to determine an individual plan of care for your loved one. From that point, the team meets to discuss the patient's progress towards meeting these goals on a weekly basis. In addition, the team meets every day in the morning to discuss any changes in your loved one's condition. In preparation for discharge to home, you may be scheduled for a day pass. Prior to the pass, an education day will be scheduled with the family so that important information about discharge can be taught. Most often, a member of the family that will be assisting with care after discharge is scheduled to meet with the nurse, physical therapist, occupational therapist, and speech therapist. More information on this will be presented later in the video. If the discharge is complicated, a family meeting can be scheduled to discuss the plan. The attending physicians on the stroke rehabilitation unit are all specialists in physical medicine and rehabilitation. Since MetroHealth is a teaching hospital, physician residents who are medical doctors also provide medical care to patients and are available 24 hours a day. The physicians treat the unique complications of stroke and other medical conditions that may arise, such as fevers or high blood pressure. Other specialists can be consulted as needed. The physicians have access to all services at the medical center, such as x-rays, lab testing, and pharmacy. When your loved one arrives to the unit, your doctor will determine which medications that were needed in the acute setting are still needed in rehabilitation. Meanwhile, some of the medications will no longer be necessary. The physician may need to add other medicines for special problems that may occur after a stroke, such as problems with sleep, pain control, or seizure precautions. Now I would like to discuss the other members of the healthcare team and their roles in the recovery process. Our nursing team consists of registered nurses, licensed practical nurses, customer care partners, and nursing interns. The role of the registered nurse is to determine the patient's plan of care based on an assessment. They administer medications, manage wound care, manage bowel and bladder issues, provide for the patient's nutritional needs, and plan the patient's care based on his or her individual needs. Patient and family education is provided with special emphasis on what information is needed after discharge. Customer care partners are unlicensed caregivers who assist patients with activities of daily living such as dressing and bathing. They assist with patients transferring in and out of bed, and as well as take vital signs, draw blood, and perform EKGs. Registered nurses oversee the activities of the customer care partners and nurse interns. Given the combination of physical limitations and memory issues that occur with stroke, safety is a top priority while planning the care for patients. Prevention of falls is a major focus for nursing staff and the team. Bed and wheelchair alarms are often used to remind patients not to get up without help and allow the staff to know when a patient attempts to get up without assistance. When these safety alternatives are not effective, restraints may need to be used as a last resort in an attempt to keep your loved one safe. Protecting medical devices such as feeding tubes, IV lines, and catheters from being dislodged or pulled out is another concern for the nursing staff. Lastly, nurses may provide assistance to the patient's family members after they are trained by one of the therapists on how to safely provide assistance. Physical therapy focuses on improving leg strength and coordination, sitting and standing balance, and physical mobility. Physical mobility includes bed mobility, transferring, and walking. Physical therapy may recommend and order appropriate assistant devices such as canes, walkers, and wheelchairs. Occupational therapy looks at strengths and coordination in the arms and a person's ability to complete self-care activities. Self-care includes a range of activities such as brushing one's own teeth, getting dressed, getting in and out of the shower, balancing a checkbook, or preparing a hot meal safely. Occupational therapy recommends adaptive equipment for self-care and bathroom equipment, as well as home modifications. Here's the therapy gym where your loved one will attend physical therapy and occupational therapy on a daily basis. Family members are encouraged to attend, but each patient is limited to 2 family members at a time. Though the gym cannot be the exact replica of your home, the therapist will try to assimilate your home to the best of their abilities so your loved one will be confident in their abilities prior to a home discharge. Speech therapy focuses on a patient's ability to understand what is being said to him and to express what he is thinking. Speech therapy looks at areas of thinking including attention, memory, planning, problem solving, insight, and safety. Speech therapy assesses and treats swallowing disorders, also determines which level of supervision a patient will need at discharge. Music therapy is the application of music techniques or methods to improve cognition, motor, communication, social, emotional, and sometimes musical skills. Music therapists use instruments such as different musical activities, exercises, as tools to aid in this process. Neurological music therapists are specifically trained in the areas of neurologic disease or damage such as brain injury, stroke, spinal cord injury, Parkinson's, etc. MetroHealth has a neurological music therapy fellow on staff that has helped many patients improve their ability to speak, think, walk, or use their hands more efficiently and functionally after suffering a stroke. It is not necessary to be a musician to benefit from music therapy. However, many musicians that have experienced a stroke have been able to return to performing or playing their instruments once again, even prior to discharge. Recreation therapy uses leisure activities to focus on the physical, cognitive, psychosocial, and spiritual development of the patient. Recreation therapy works to develop new leisure skills as well. Recreation therapy educates patients on adaptive equipment for leisure and many different community resources. Recreation therapy holds various groups throughout the week and may see patients individually. Art therapy uses art in a creative process to represent the patient's development, abilities, personality, concerns, and conflicts. Art therapy increases self-esteem, develops social skills, manages behavior, and aids in reality orientation. Art therapy offers 2 groups a week and sees patients individually bedside. The rehabilitation psychologist is a specialist in rehabilitation psychology. The rehabilitation psychologist evaluates and treats difficulties with adjustment to stroke and counsels individuals when necessary. Our social worker primarily serves as a liaison between the family and the team. The social worker also assists with coordinating an appropriate discharge plan for the patient, whether it be home or to another nursing facility. The social worker and the case manager work closely together in making discharge plans. The case manager will discuss patient goals and the patient's progress towards meeting the goals with the insurance company. The case manager is also involved in ordering any supplies you may need for after discharge. Recovery from stroke is variable and is different for every patient. We recognize that the process of recovery is difficult not only for the patient but impacts the family as well. Our goal as a team is to support the patient and family throughout this process. For most patients, you may see more significant improvements early in the recovery process with a slowing of improvement as time passes. There is no time frame in which stroke recovery stops. Improvements may continue to be seen after the first year of injury. Therapeutic Path Home is designed for the family and the patient to practice the skills they have learned during the hospital stay. It also allows the family to get a sense of how much assistance the patient will require after discharge. Generally, a day pass occurs the weekend before discharge. Family Education Day is set up during the week before a patient goes on their therapeutic day pass. Family members attend speech therapy, occupational therapy, and physical therapy with the patient in order to receive the training and information that they need for a safe pass and discharge. Family may also meet with the nursing and/or the physician to discuss medical and nursing issues. All patients that are to be discharged home will receive a recommended level of supervision at discharge. This recommendation is made to promote a safe environment for the patient at home. As the patient continues to improve while at home, the amount of supervision needed may change. In this slide, you can see the categories we may recommend. In most cases, patients will still need some restriction after discharge. Typical restrictions include no driving, no power tools, no ladders, no alcohol consumption, no return to work or school. These restrictions should continue until your loved one is reevaluated by a physician at the follow-up appointment. Most of our patients with the ability to provide social support go home after discharge. In these cases, the patient has progressed physically and cognitively to a point where they need minimal physical assistance and close supervision. The patient support network, friends and family, have agreed that they can handle this level of responsibility. The therapeutic day pass helps family realize what is required to keep the patient safe. At the time of discharge from the acute stroke unit, the patient may not be ready to go home and may benefit from continued therapy. Some patients may need to go to a skilled nursing facility or intermediate care facility, which allows more time and opportunity for recovery. Most patients will need to continue attending therapies after discharge. Patients who are homebound and not able to get to outpatient therapies after discharge may be appropriate for home therapies. If outpatient therapies are recommended, the therapies are typically 2 to 3 times a week. The outpatient therapist determines how long a patient needs each therapy after discharge. The outpatient therapist may provide therapy that simulates your loved one's vocation and may even perform a driving evaluation when appropriate. For help in contacting resources in the community, feel free to contact the Gerson Center for Assistance. MetroHealth also hosts an annual consumer forum, which is an educational conference for stroke patients and their families. The conference is held every year in the fall. The National Stroke Association is also a great source of information and resources which can be accessed via the internet. Their website offers many tips for healthy living after having a stroke. MetroHealth holds a support group at the Old Brooklyn campus monthly and is open to stroke survivors and their families and friends. Each month, someone from MetroHealth will speak to the group on a wide variety of pertinent topics. If needed, a smoking cessation program in Alcoholics Anonymous is available for individuals and is offered free at no charge at Metro.